Omicron continues to throw a wrench in the pandemic, with the Food and Drug Administration recently announcing at-home rapid tests may be less sensitive at detecting the highly contagious variant.
Fox 12's Haley Rush sat down with a diagnostic test expert at Oregon State University today and joins us now with what we need to know. Haley?
Well, these are what people are after right now. You can buy them at local pharmacies. That's if you can find one. And while these have always been less sensitive than, say, a PCR test and prone to user error, we're learning these could miss some infections more than ever before.
They're flying off the shelves, yet they may not even work well against Omicron.
Today, the really what's emerging in the evidence, in some of the studies that we're seeing is that Omicron is actually results in a lowered sensitivity of these antigen tests, and that's a real problem, obviously, if you're testing yourself.
That's Justin Sanders, assistant professor, senior research at OSU in the Carlson College of Veterinary Medicine. He also specializes in infectious disease and the development of molecular diagnostic tests.
Why do you think these tests may be less sensitive to Omicron?
It turns out, at this point, what we know, it's not a matter of the virus, the test not recognizing the virus, but more where the virus is located. So Omicron appears to really infect tissues that are more lower than in the upper nasal passages.
He says most at-home antigen tests, also known as rapid tests, require a nasal swab, but Omicron may be better detected in saliva.
So obviously a lot of people are trying to get their hands on these tests across the country and in Oregon right now. Is that still a good idea?
That's a difficult call to make. I think that it is. I think that more testing is always a good idea, but people really need to understand, and there needs to be a really clear understanding that these tests are not going to prevent COVID.
So when should you take an at-home test? Sanders says your best chance at getting an accurate result is to test when you have actual symptoms. If you don't have symptoms, he says, hold off.
If you've been exposed, for example, to someone, a confirmed case of SARS-CoV-2, waiting a few days after that exposure can actually, increase the sensitivity, the possibility of detecting it if you are infected. Serial testing, if you test more frequently, the actual overall sensitivity is better for these types of tests, for any tests.
Sanders says molecular tests or PCR tests are still the gold standard if you can get one. He also tells us he wouldn't be surprised if companies start making at-home tests that focus on saliva, but that could take some time for the FDA to approve. In studio, Haley Rush, Fox 12 Oregon.